Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today, he was never on the Slice of Healthcare podcast before, but he was on Nick's Notes. I'm here with the co-managing partner and the co-founder of Tau Ventures, Amit Garg. How are you today?
Hey, Jared, thanks for having me. Yeah, I've been a big fan of the podcast for a while now.
Thanks. Yeah, I'm really excited to have you back on. I'm glad that we were able to get connected, obviously through Nick at Hey Renee, and now we're having you on this podcast, which, as you and I were discussing, hopefully we can make this a couple times a year thing to talk about some of your latest investments. I think the audience will really be interested in hearing about that. So just so everyone knows, what we're going to do today is Amit's going to go through some of their, I think, last three investments that Tau Ventures has put together and kind of provide some clarity on that. We're going to make this fast, short, and sweet. And I'm really looking forward to it. So, Amit, I'll leave it up to you to kind of maybe just give us the quick spiel on Tau Ventures for those that aren't familiar, and then we can go through these latest three investments.
Sounds good. So Tau Ventures, we are headquartered in Palo Alto in the heart of Silicon Valley. We are 45 million AUM, just over 2 years old as a fund. We focus on applied AI, artificial intelligence. I do the healthcare side. My co-founder Sanjay does the enterprise side. We have just over 30 deals. It's all on our website, tauventures.com. And we focus especially on seed investments. And more specifically, when a company is just starting to take off. So it's, handful of folks, 5, 6, 7 people usually. And they have line of sight here towards getting recurring contracts. We like to think of it as we are adding fuel to the rocket engine so that you can go and raise your next round, your Series A, within 9 to 18 months. You have a pipeline of customers, and we will help you basically turn that into recurring contracts. In terms of the healthcare thesis, I focus a lot around oncology, done computer vision for colon cancer, machine learning for repurposing drugs to treat cancer, focus a lot around chronic disease management. So, how do we take care of heart disease, obesity, blood pressure, all the big stuff. And then the third part of my thesis is what I call the back end of healthcare, fraud, waste, abuse, payments, billing, workflows, right? Healthcare, as we all know, is especially in the US, very bloated. About 1/3 of all the healthcare costs are just paperwork, administrative, and we are trying to find ways of improving that. So with all that said, let me share here about our last three investments. The first one that I would like to talk about is called Signos, Signos. Signos is very deeply meaningful to me personally also, because they're helping you lose weight, get healthier. And it's something that I did in myself personally. Before I came across Signos, about 9 years ago, I lost 35 pounds in 3 months. And I had even torn my knee 3 times, overcame that to do Ironmans and marathons. And have had a personal journey. And I built a company around this along with other co-founders of mine called Health IQ. So when I came across Signos, immediately there was resonance. It was like, oh, I get it. I understand the need here. I understand how you're going to do this, why you're going to do this. And in the case of Signos, the CEO, Shahram, also has had a personal journey, and he talks about it publicly on getting healthier. The key insight that Shahram had is that he can repurpose continuous glucose monitors. They're typically used for diabetes. But what if you were to give insights to people on what's going on inside their bodies in real time so that they can control their blood glucose? And turns out if you can keep your blood glucose within a certain range, there's a lot of research around this, you actually lose weight. It should be obvious, right? If you don't spike your blood glucose, then that means that you're eating relatively healthy, you're exercising relatively healthy. We all know the drill. That's what we should be doing. But how to do it is the challenging part. And with Signos, you basically get a program, you get the product. The continuous glucose monitor that they provide right now is from Dexcom, which is one of the better companies out there. And what Signos focuses on is on the analytics, on the data side, on giving you a visual representation of what is truly happening inside your body when you eat that quinoa, or when you eat that kale, or when you eat that cheesecake, right? Like, this is the effect that happens right away in your body, individually, personalized, data-driven insights so that you can then take the best decisions. Um, so we invested, and we are an AI fund, so we see a lot of promise around the data that uh, Signos is collecting. Um, I wrote an article about this, by the way. Anybody is interested, they can read more on LinkedIn. In fact, I publish articles all the time, and hopefully in the near future, I'll be talking about all of them with Jared on this podcast. So let me talk about our second investment here that I want to highlight. It's called Klivo, Klivo. And this is a company that is a first for us in many ways. It's a company that's based in Brazil and is focused in Brazil. Um, and we have a very deep understanding of that market because I was actually born and raised there. But Tau Ventures overall focuses on the US. We are willing opportunistically to invest outside, especially in Canada because it's close enough, but also in markets that we understand well. And Klivo is actually the very first example of an investment that we did that's outside of the US. And in Klivo, what they're doing is chronic disease management at its finest. And they're focused on the one that makes a lot of sense for a country like Brazil, and unfortunately also for a country like the US, which is diabetes. How do you help people manage their diabetes? How do you help pre-diabetics manage their conditions so that they don't end up getting diabetes? And the overall thesis here is something that should make sense to everyone, which is let's prevent the problem, or let's prevent it from getting bigger, because then you save a lot of suffering, a lot of grief, and a lot of costs. And it's good for the patient, it's good for the provider, it's good for the payer. All the incentives are aligned here. So what Klivo does, it's focused a lot right now on employers. It provides through the employers to hundreds of thousands of patients the ability to monitor their medication adherence, their appointment reminders, their lifestyles, and it's there are companies with similar models here in the U.S. But if you look at an emerging market like Brazil, this is something that is very much needed, even more so needed, because there's a gap in the market, and that's what we saw. Our interest, obviously, with this company, beyond the fact that we see a phenomenal entrepreneur, its co-founders who have built previous companies before successfully, is the fact that unfortunately in Brazil, it's a 210 million person country. It is the second biggest market in the Western Hemisphere, and you are hitting the same levels of diabetes as here in the US. In the US, as a comparison, just about 10% of the folks have diabetes, and there's another additional 10 to 15% that are at risk of diabetes. So it is a global problem. More and more emerging markets have the same dynamics as developed markets. So it's a big part of our thesis here is invest in big markets where software can help drive more efficient solutions. So let me go on now to the third company that we invested in. And this one is a very recent investment. It is literally as of 3 days ago, or 4 days ago, as of today, that we announced it. And it's called Marigold Health. And it's something that I'm really excited about because I've been looking for a mental health play in our portfolio for a really long time. And there are many, many really good companies that are making a very meaningful dent around improving how we do mental health. I felt very lacking that Tau Ventures hadn't still supported a company with such a meaningful mission. And we found that in Marigold. The founder is somebody I really feel inspired by. He is somebody who started thinking about this problem while he was still in college. And then when he came out of college, he started building this company. And he has been at it for a few years now, to the point that some really good publications have highlighted his journey. He was on Business Insider, actually, I think in October 2018. For anybody who's interested in reading his profile, he was featured by them. But a good team is always the foundation of any good investment. But the next part of the story with Marigold is what they're actually doing, the mission. It's helping addiction. It's helping drug abuse. And they're focused especially on a population that's really, really tough to work with. It's a population that maybe not earning as much, what I would like to say, maybe it's the bottom of the pyramid, the middle of the pyramid. It's a population that has a lot of other social issues that they're dealing with. The opioid crisis, many of us have read about it, heard about it. We may know people who suffer from it. It's a population very much at risk of those kinds of addictions. And it's a population that it's hard to make a difference. There's skepticism and resistance from them on changing behaviors. Changing behaviors is hard anyways. So what Marigold does really well, it says, instead of us preaching here, we will find addicts who have actually recovered, who have made a change, and we're going to have them actually be our spokespersons. We're going to pair them up and do a community-based, chat-based approach. We're going to help people who have already succeeded help others who are at different points of that journey. And that carries a lot of credibility, a lot of weight, right? Like if I know that this other person I'm talking to was an addict like me who now has recovered, the chances of me actually listening and doing something about it are much higher. That's Marigold's solution. They're working with some big pairs, especially in the greater DC, greater Boston area. And we're very excited to have done their seed extension alongside a bunch of other funds. Once again, if anybody is interested, there's a lot more that I publish online about the companies. I'll mention one last thing, the AI angle. For us, it's the natural language processing. So Marigold uses natural language processing to understand intent. Whenever there's a communication going on, and many communications going on, Marigold is able to extract a lot more understanding of what's going on and what triggers could be helpful and what kind of help a person really needs based on the interactions that they're having. So once again, it's a data-driven approach in this case to helping make a very meaningful impact, helping people get rid of addictions. So Jared, let me take a pause here. I've spoken about all three investments and would love to answer deeply any other questions you think of our listeners might have.
I really appreciate your breakdown of each of the companies and why you invested. And by the way, just so everyone that's listening, the articles that Amit is referring to, we'll tag those in the show notes and in the post. So people, this will be this really is if people want the audio video version, right? And then they'll always be directed back to your initial post that you write some detailed, some great. One of the best, basically, why we invested posts that I've seen, and they always show up on into my LinkedIn feed. So yeah, by the way, too, if you're not following Amit on LinkedIn, you're really missing out. Do it. Don't think about it. Do it. Yeah, so we'll put your social media links in the show notes. We'll put links to the initial articles. But no, I don't have any. You gave me exactly what I wanted. I wanted to know why you invested. You broke it down perfectly, and we did so in a timely manner. So I really appreciate you doing this, and I can't wait to make this more of basically a regular thing where we're able to get you on from time to time and kind of do a deep dive into some of these companies in 15 minutes or less. So really appreciate that.
Awesome. Well, Jared, appreciate it. And let me just throw this one last thing here for all of our listeners. If you get interested in any of these three companies I mentioned, or any company for that matter in our portfolio, they're all listed on our website, taoventures.com. Whether you're interested in working with these companies, working at these companies, partnering with them, whether you're a payer, provider, or even a patient, feel free to reach out to those CEOs or feel free to reach out to us, and we'll be happy to make that bridge. I do read every single message that reaches us. I am not able to respond to every single thing, but I do actually take care of reading through everything that comes to us.
I have a request. I want those companies on the podcast at some point.
Oh, you got it.
Yeah, let's do it.
I'm more than happy to make those introductions. In fact, Jared, right after this, I will put you in touch with all three.
Thank you so much. Awesome. Well, can't wait to can't wait to have this conversation again real soon. Thank you so much, Amit, and looking forward to the next conversations.
Thanks, Jared. Stay safe, everyone.